Today's topic is bad breath or halitosis. The definition of bad breath or halitosis is an unpleasant smell coming from the mouth. Halitosis can occur on occasion, or it can be a chronic condition. It may be caused by foods a person eats, poor oral hygiene, diseases, or other factors. Causes. There are a number of possible causes of bad breath or halitosis. Poor oral hygiene. The most common cause of bad breath is poor oral hygiene. Bacteria that build up on your teeth, particularly between them, as well as your tongue and gums, can produce unpleasant smelling gases. These bacteria are also responsible for gum disease and tooth decay. Food and drink. Eating strongly flavored foods, such as garlic, onions, or spices, is likely to make your breath smell. Strong-smelling drinks, such as coffee and alcohol, can also cause bad breath. Smoking. Smoking is another cause of bad breath. As well as making your breath smell, smoking stains your teeth, irritates your gums, and reduces your sense of taste. Crash dieting. Crash dieting, fasting, and low-carbohydrate diets are another possible cause of bad breath. They cause the body to break down fat, which produces chemicals called ketones that can be smelled on your breath. Medication. Some types of medication can also cause bad breath. These include nitrates. These are sometimes used to treat angina, chest pain caused by a restriction in the blood supply to the heart. Some chemotherapy medication, tranquilizers. Medical conditions. In rare cases, bad breath can be caused by certain medical conditions. In dry mouth or xerostomia, the flow and composition of saliva may be affected. A lack of saliva can cause more bacteria than normal to build up in your mouth, as well as a change in the type of bacteria. A buildup of these in the mouth may lead to bad breath. Dry mouth can sometimes be caused by a problem in the salivary glands, or by breathing through your mouth instead of your nose. In some cases, gastrointestinal conditions can also cause bad breath. For example, a bacterial infection of the stomach lining and small intestine, or H. pylori infection, and gastroesophageal reflux disease, or GORD, have been linked to bad breath. Halitophobia. Some people are convinced they have bad breath when they don't. This psychological condition is called halitophobia. Symptoms. The specific odor of breath can vary depending on the cause of the problem. It is best to ask a close friend or relative to gauge your mouth odor, as it can be difficult to assess it yourself. If no one is available, one way of checking the odor is to lick your wrist, leave it to dry, and then smell it. A bad smell on this area of the wrist is likely to suggest that you have halitosis. Diagnosis. You have halitosis if you have bad breath, and a doctor is not needed to diagnose the condition. However, if your bad breath is chronic, if it does not go away with proper oral hygiene, or you have other symptoms, you will need to see a doctor or dentist to diagnose the underlying cause. A doctor or dentist will examine your mouth to look for signs of gum disease, dry mouth, or infections that may be the cause of your bad breath. Treatment. In most cases, your dentist can treat the cause of bad breath. If your dentist determines that your mouth is healthy and the odor is not of oral origin, you may be referred to your family doctor or to a specialist to determine the odor source and treatment plan. If the odor is due to gum disease, for example, your dentist can either treat the disease or refer you to a periodontist, a dentist who specializes in treating gum conditions. An antiseptic mouthwash can help eliminate bacteria that cause bad breath. Ask your dentist about which product is best for you. Thank you for watching our video.